Hello, I'm going to talk about the most common injuries seen in basketball. To me, the most common injuries occur to the ankle, the hip, and the fingers. In ankles, the injury that is most common is the ankle sprain. This injury is common because in basketball, you run and you jump and you use your ankles for this constantly. For the hip flexor strain is a big part of the movements in basketball because you constantly use it to use your hips to be in an athletic position, to change direction. And in fingers, the finger mallet is a common injury because you use your fingers to use your hands to dribble the basketball, to pass it, or to shoot the basketball. Some injury factors that can play a part in the sport of basketball, and in reality any sport, can be, for example, stress, which is a physiological factor. Some things that can cause stress is family situations, whether it can be anything from financial, family, like parents splitting apart, or it can either be a coach that is not that's not well trained and maybe not having a positive influence with his players. Another factor could be physical. For example, an uneven basketball court, or playing in a hard surface such as cement, which is hard, rather than a wooden floor, which is softer on your knees and your joints. And another factor that can play a part in basketball injuries is something biological, such as your growth, physical growth, such as in young athletes, their body's still developing quickly, so we want to make sure and not overstress their body to where it's going to affect their joints and their growth and cause injury. And for adults, such as adults' bones deteriorate as they get older, so it's important for adults to keep active and make sure they get an adequate rest and let their muscles recuperate to prevent injury. It is important for us to understand the hip flexor strain anatomy. And with this, the hip flexors are responsible for moving the knee towards the chest. And during activity, they are particularly active when sprinting or kicking. Whenever the hip flexors contract, they are put under stretch, and tension is placed through the hip muscle fibers. When this tension is too much, due to too much repetition or high force, the hip flexor muscle fibers may tear. When this happens, the condition is known as the hip flexor strain. We must also understand the mechanism of injury. Injury to the hip abductors most commonly occurs following the forced push-off, which is a side-to-side motion. An extreme amount of force is placed on the adductor tendons because of the athlete's momentum. A large amount of force is applied to one side in the sagittal plane, and the adductor's muscles must contract quickly to shift the force to the opposite direction. A second mechanism of injury involves the athlete landing in the splits position with the hips flexed, abducted, and externally rotated. And the most common mechanism of injury is when an athlete is running and lands on the feet or his flexed knees, striking the ground while the hips are flexed, abducted, and internally rotated. Now, treatment of the hip flexor strain requires, as soon as that happens, RICE. With RICE, that stands for rest, ice, compression, and elevation. This is going to be helpful to help those muscle fibers heal. Now you want to do this 20 minutes out of every 2 hours a day until the muscle fibers have healed. And it's also helpful to once the muscle fibers have healed, it's also helpful to do some exercises. I say preventative. You can do gentle stretching exercises, which they'll help reduce the flexor muscle tension, and they'll reduce the likelihood of future injuries. The hip flexor stretches will help straighten muscles, but make sure not to push too hard. Stretches should be gentle. It can help reduce the risk for hip flexor strain if you apply a moist heat and warm towel to your muscles with a gentle walk for about 3 minutes before stretching. So now, after the hip flexor strain has healed, it is important for us to know some rehab and preventative exercise. I have provided two: the hip flexor stretch and the hip flexor stretch, two hip flexor stretch exercises. The first one involves kneeling. So what you want to do, you want to kneel on your affected leg and bend your good leg out in front of you, with that foot flat on the floor. If you feel discomfort in the front of your knee, place a towel under your knee, keeping your back straight. Slowly push the hip forward until you feel a stretch in the upper thigh of your back leg and hip. Hold the stretch for at least 15 to 30 seconds. You want to do this about 2 to 4 sets, 3 times per week. Now for the hip flexor stretch, the hip flexor stretch exercise number 2. This involves the edge of a bench. So you want to lay flat on the bench or a table with your knees and lower legs hanging off the edge of the table. Grab your good leg at the knee and pull that knee back towards your chest. Relax your affected leg and let it hang down towards the floor until you feel a stretch in the upper thigh of your affected leg and hip. You want to do this 15 to 30 seconds, 2 to 4 sets, and 3 times per week. Moving on to the ankle sprain anatomy. The most commonly torn ankle ligament is the anterior talofibular ligament, which is on the lateral aspect of the ankle. Ligaments on the lateral aspect of the ankle include the calcaneus fibular ligament, and the posterior talofibular ligament. On the medial side of the ankle, the strong deltoid ligament complex, which consists of the posterior tibio-talar ligament, tibio-calcaneal ligament, and the tibio-navicular ligament, and the anterior tibiolateral ligament, may be injured with forceful eversion. The most common mechanism of injury for an ankle sprain is an inversion injury, which is commonly called a lateral or inversion ankle sprain. This is when the foot is forced into a combined movement of plantar flexion and inversion, which applies too much force to the lateral structure of the ankle, causing them to fail. A less common mechanism of injury involves a forceful eversion movement at the ankle, resulting in injury to the strong deltoid ligament. There is also a syndesmotic sprain, which is a high ankle sprain. This one occurs on the distal tibiofemoral joint. Sprains to the syndesmotic ligaments are more common than people think. The ligaments are torn with increased external rotation or forced dorsiflexion, and are often injured in conjunction with severe sprain of the medial and lateral ligament complexes. Once the ankle is ready for treatment, the first thing you want to do is RICE, which is rest, ice, compression, and elevation. After the the swelling has gone down and you're ready for the next step, it's immobilization. With the immobilization, you wanna make sure the immobilization for the initial treatment of an injured ankle. Then you want to rehabilitate, which can begin when the swelling has gone down and is under control. Care must be taken because aggressive rehabilitative activities during the acute phase of a sprain may increase pain, cause re-injury, and inhibit the patient's participation in treatment. 2 ankle sprain and preventative rehab exercises are the towel stretch and the ankle resistance stretch. Now with the towel stretch, you sit with your legs straight in front of you. You place a rolled towel under the ball of your foot, holding the towel at both ends. Gently pull the towel towards you while keeping your knees straight. Hold this position for about 15 to 30 seconds. You do it 2 to 4 times, 2 to 4 sets. And in moderate to severe ankle sprains, it may be too painful at first, but your toes, first pull your toes far enough to feel the stretch in your calf. Use caution and let pain be your guide. So you want to do this 2 to 4 sets, 15 to 30 seconds, and 3 times per week. Now with the ankle resistance, you want to place the heel on your other foot on top of the injured one. Push down with the top heel while trying to push up with your injured foot. Hold it for about 6 seconds, then relax. You want to do this 1 to 2 sets, 8 to 12 reps, 3 to 5 times per week. We are moving on to the third most common injury in basketball, which is the extensor tendon avulsion, also called the mallet finger. Anatomically, it is the most common mechanism of injury in the mallet finger, which is a sudden flexion of the DIP joint with the resistance force directed along the long axis of the finger. This leads to terminal extensor tendon tear or tendon avulsion with a bony fragment. Moving on to the mechanism of injury. The mallet finger is one of the most common injuries in basketball, and it occurs when a ball strikes the end of the extended finger, causing forceful bending of the last finger joint, which is a DIP joint, and the rupture of the tearing of the extensor tendon, which is attached to the finger bone. Injured fingers become painful and swollen at the DIP joint, and the tip of the finger feels and looks stuck in a bent position. If it's not treated in a timely fashion, the injury can lead to a permanent deformity and discomfort. Once the injury has been diagnosed, now the next step is to treat it. For treatment, we want to have a splint. The splint should be a full-time splint and is recommended for 6 weeks, followed by 2 to 6 weeks of splinting at night and during strenuous activities. This treatment is generally accepted and usually gives satisfactory results. The most common splint is a stack splint made out of plastic. Other common splints are the custom-made thermoplastic stack splints, aluminum foam splints, and Albuno. With that said, we'll move on to preventatives and rehab exercises. The first one will be the finger tip stretch. With your good hand, what you do, you grasp your problem hand. Your thumb will be on the top side of the finger. Place your thumb just below the joint that is close to your fingernail. The index finger of your good hand should be underneath the tip of the problem finger. With your index finger, slowly push the tip of your problem finger. Push until you feel a stretch. Hold for at least 15 to 30 seconds, 2 to 4 sets, 3 to 5 times per week.